I've been in practice since 1982, and 1987 I decided to do solely knee problems since I was taking care of so many knee injuries in athletes. I've been collecting the data on these patients from the beginning, and I really wanted to focus on improving the results of knee injuries in athletes, primarily ACL tears. The question that we tried to answer was the one that one of my patients' mothers asked me in 1982 when I'm talking about what I'm doing to her 15-year-old daughter as far as reconstructing her anterior cruciate ligament. And I was describing all the surgery and the rehab, and she looked me in the eye and said, "Dr. Shelbourne, what's going to happen to my daughter's knee in 20 years? And I could honestly say, I don't know. And that led me to understand the implications of what we're doing to these patients now and how it can affect them in the future. And if we don't understand what we're doing and how it affects their future, then we need to learn something, and that's what the intent of this study was. Well, the main findings were the stability, like we had proven before, is maintained. The things that we also in the past had found out is that meniscal and condyle injuries can affect the outcomes of patients with ACL surgery, but the most important finding was the lack of normal knee extension compared to the opposite side was a significant factor leading to a higher incidence of osteoarthritis by itself and also a higher incidence of osteoarthritis when combined with meniscal and condyle injuries. And this is a modifiable objective that we have, and so it's very important for us to understand this and do what we can to make sure the patients get full extension back. Well, definitely we're following up with our recent patients because these patients were from 1982 to 1994, and what we've done since 1994 is be more aggressive with the rehabilitation afterwards, and our rate of getting extension and flexion back now is much higher than it was for the patients in this study, and hopefully that will lead to fewer bad results in 20 years.